Welcome to Ignite Health, brought to you in partnership with Caribbean Surgery Inc. This program is dedicated to empowering you, our wonderful audience, with trusted medical information, expert insight, and practical advice to help you control of your health, to take better control of your health. I am Dr. Surendra Persaud, the Medical Director at Caribbean Surgery Inc., and your host. Each week, we explore important health issues affecting individuals, families, and communities across Guyana and the wider Caribbean, helping you better understand your health and well-being. Because informed choices today can lead to healthier lives tomorrow. In this episode, we will be discussing anxiety, one of the more common conditions, but often misunderstood conditions affecting our mental health and affecting people of all ages. Many of us experience worry, stress, and pressure in our daily lives. But when do these feelings become something more serious that we should seek medical guidance? Joining us today is Dr. Triston Griffith, a psychiatrist at the Georgetown Public Hospital and an adjunct professor at the University of Guyana. Dr. Griffith has had extensive experience treating anxiety, depression, trauma-related disorders, and other mental health conditions. His research during the COVID-19 pandemic also looked at how those events affected our mental health in Guyana. Dr. Griffith, thank you very, very much for joining us today. Before we get into anxiety, tell us a little bit about your work in psychiatry.
So, I'm a part of a very dynamic team at the hospital where we treat patients and try our best to improve the mental health of all that come to us.
Okay. Now, let's speak about the pandemic because that's still in most of our memories. How did the pandemic uniquely affect Guyanese and especially the mental health of Guyanese?
Okay, a little bit about what it is that I looked at. I was very interested to see exactly that. How did the pandemic affect our Guyanese population by looking at the kinds of patients that came prior to the pandemic and those that came after the pandemic, well, a period of time after the pandemic had kind of subsided. And it was very interesting.
Now let's go back to today's topic of anxiety. I think all of us have heard the term anxiety, but I would like you to sort of give us maybe two descriptions. What does John Public, when they say, I have anxiety, what are they talking about? And what, from a medical standpoint, when we say somebody has anxiety, are we describing?
So anxiety in its simplest terms speaks about worry. Most persons, when they say that they have anxiety, they're speaking about the fact that they worry a lot or there's something that they're concerned about. From a medical perspective, anxiety represents a feeling, and it's more commonly in psychiatry associated with various disorders that concern overwhelming worry.
Now, when you have anxiety on this hand and you speak about stress, how are they related? How are they different? How are they similar?
Okay. So stress is something that I think we all can identify with. We all have a very vague understanding of what stress is, but we know when we're experiencing stress. Stress is identifiable. It's something that you can recognize. It's something that is there. Anxiety is more of a feeling of worry about something that is not there. And so the differences lie in that quantifiable nature of it. So stress is something that you can see, observe, recognize, identify. But anxiety is a feeling that's there just bubbling under the surface, and it's something that you experience, especially when there is nothing that's identifiable to cause you to feel that way.
We'll get in later about anxiety as one of the mental health conditions, but how has this changed over time? Many times we speak to people and they say, well, all of these things are relatively new, but they're not new. But how would you say the levels of anxiety or the commonness of anxiety has changed over time, and where are we today with anxiety as a population?
I agree with you. I like to say that there's nothing that's new under the sun. I think we've always had anxiety or might have dealt with various disorders concerning anxiety. But as time has progressed, we've become more aware of what it is, what the signs and the symptoms are, and people are becoming more comfortable speaking about anxiety and recognizing their own anxiousness.
Now, as you've said, we all experience stress, we've all experienced some level of anxiety. But what is it? What are the changes? What does the public need to think about? What is different that you should say, I need help. I need to speak to somebody. What is it about changes about anxiety that should trigger that response?
Okay. So with most mental health conditions, including anxiety, when there is a change in your ability to function and to cope and to be harmonious with your environment. So the person that's experiencing overwhelming anxiety would not be able to meet their obligations or won't be able to have that life that they were previously accustomed to. That's when you recognize that this is something that's wrong and I really need to kind of take a moment and seek some professional help or try some things on my own.
Now, in almost all of our family discussions or almost all of our patients will come in and you will hear these two terms, I'm under pressure or my nerves are acting up. Help us understand what Guyanese mean when they say that in layman's terms, and then how does that link into the topic anxiety?
So pressure, when we speak about pressure, we're talking about stress. And as I mentioned before, we all have an understanding of what stress is, but necessarily creating a formal definition of it is a bit more difficult. So pressure talks about the stresses of our life. Whatever stress we're going on, our boss is applying stress, pressure, we got school work to do, different things, okay? Now, when we say our nerves, I feel the term nerves might be a Guyanese thing, and I really enjoy it. In my profession, when people say that their nerves are bothering them, it's never one direct particular thing. It's always very person specific and a bit nuanced. So you have to kind of go a little deeper and find out what it is about their nerves that's bothering them. And so nerves is just a general, as physicians, we know about chief complaints. So this chief complaint would be that our nerves are bothering them. And then as the psychiatrist or mental health person, you go a little deeper to find out exactly what symptoms the patient or the person is experiencing to really be able to identify and quantify what they mean about their nerves.
Now, coming back to anxiety, are there specific types or branches that we say there's anxiety disorders?
So what I didn't do earlier was kind of identify what is anxiety. We are aware of what is fear. Fear is a reaction or a response to an imminent threat. So there's something in front of you, and that feeling that you get when you're in danger, that's fear. Anxiety is if this threat is not in front of you, you have that same feeling, you have that same fear. And so you are having the same physiological response to something that's not there. Now, there is physiologic anxiety and then there's pathologic anxiety. Physiologic anxiety is a good thing. Physiologic anxiety keeps us safe. So physiologic anxiety is that thing that ensures that if you're nervous about driving, you're gonna make sure that you follow the rules. You're gonna indicate when you're driving. You're gonna see somebody driving in a disorganized way and you're gonna avoid them. That's your physiologic anxiety. Pathologic anxiety is what I spoke about earlier, where you are now feeling so worried all the time that you're unable to kind of do the things that you normally do. You feel overwhelmed by this anxiety and your life is not the same as it was prior to developing this.
Now, many persons, when we are discussing diseases, but especially diseases that fall into the category of mental health, they are concerned, one, they don't want to talk about it. Two, is it going to be something that the doctors can treat? So I think one of the key messages I want you to be able to get across to our audience is how common this is and how, one, can it be treated and how successful are we at helping people cope with this?
So to the first point, I'm happy that you mentioned the fact that a lot of people are still a bit uncomfortable speaking about mental health conditions. So as a psychiatrist, my job is one of the hardest because I have to treat something that cannot necessarily be seen. And I think that's part of the reason why people are uncomfortable with discussing their mental health conditions, because as a society, we tend to only think that illness speaks about things that are identifiable or things that you can see. So if your leg is broken, you know that your leg is broken. But if you're suffering from something that affects your mind, it's a bit harder to understand that, okay? Anxiety is very common, especially in our local setting. Lots of people experience anxiety, and anxiety really does not prefer a particular type of person, even though women are more affected by anxiety. And to the other part of the question in terms of how well it's managed, so there are many options that are available in terms of the management of anxiety, and we are seeing great success rates for the persons that come because they are aware that something is wrong.
Now, you drew a distinction between sort of fear that's being helpful and fear that is not helpful. So you spoke about, let's say, I'm about to drive and I have a concern, so I may adhere to certain things. Now, there is fear that you're experiencing, the anxiety when that stimulus isn't there. Help us understand what are the more common symptoms and how people can recognize that they are having inappropriate anxiety.
Okay. So I, as mentioned before, I'm an adjunct professor. I really appreciate mnemonics. There is a mnemonic that I really like when it comes to anxiety, and it goes a bit like this. So whenever you're feeling very nervous or worried, if you hold a piece of ice, it will calm you down. And so the mnemonic is try ice, but it's spelled TRIICE. And those talk about the core symptoms that are associated with a generalized anxiety disorder. And the first one is tension. Lots of times, people that are anxious, they experience that anxiety in muscles in their body, and they would feel tension across their shoulders, behind their neck, and things like that, okay? So that's one of the symptoms, okay? The other one is restlessness, or this inability to relax. You always feel like you're on the edge. You always feel wound up, like those cars
Correct.
that just keeps going, you feel wound up, that restlessness, okay? The I talks about insomnia. So lots of times persons that have anxiety, they have difficulty sleeping. So insomnia is a subjective displeasure with the quantity or quality of sleep that a person has attained, okay? The next one is irritability. Lots of times persons that are anxious, they're very irritable. Everything kind of triggers them. They feel angry for things that they might not have been angry about before. Another symptom, the C, is concentration. Lots of times you're unable to focus on the task that's at hand. People often perceive that as impairments in their memory because their concentration is altered. And the last symptom is fatigue or low energy, E for energy, okay? So if you feel tired a lot without being worked, that's a symptom of your anxiety.
Now, what Doc has said is quite a lot there, and I'm sure our producers will create a nice post with that TRIICE, TRIICE, to help you, because that's very, very important, because what we're trying to do is to make sure that everybody understands many of us are going to experience this on a regular basis, and identifying a condition is possibly the greatest way in which you can help yourself and help us. Because if you can't identify that you're having this situation, it's very difficult for you to come and seek help. Dr. Griffith, let's go back and talk about panic attacks. So one, I want you to talk about what is a panic attack, how is it related to anxiety, and most importantly, I want you to demonstrate as if you were having a panic attack and walk us through with our audience what are the things people can feel, what experiences they may go through. So panic attacks.
So a panic attack is an upsurge in fear. It's something that happens to persons that are experiencing intense anxiety. It's often unpredictable and it peaks very quickly. So when you're having a panic attack, you can experience symptoms in certain, in different organ systems, like your cardiovascular. You can have palpitations, you can feel your heart pounding in your chest, you can feel tightness in your chest, almost as if you're having a heart attack. In your respiratory system, you can have shortness of breath or feel like if you're panting or you just can't even breathe. You can have in your skin, you can feel sweating, you can feel tingling, paresthesias in your gastrointestinal system. You can feel nauseous. You can have lots of GI-related symptoms. Psychologically, you can feel as if you're going crazy. Oftentimes, when people have panic attacks, they do feel like if are about to lose control and they're unable to keep grounded and to keep intact with their own reality. Now, if you are experiencing a panic attack, some grounding techniques are really, really important. Some are simple, some are a little more complicated. So a really good one that's very easy is to kind of rub your legs on your thighs, rub your hands on your thighs and focus on that, because what you want to do is to distract your brain and kind of bring it back to reality so you can feel the way how your hand feels on your thighs. Another really good thing that I discuss with patients is there is a game that you play that incorporates your five senses. So you look around your immediate environment and you find 5 things you can see. You identify them. 4 things that you can possibly hear. So you quiet your mind, you listen for 4 different songs that you can recognize. Maybe you can try to find 3 things that you can smell, something that you can touch, like 1 thing that you can touch, 2 things you can touch, sorry, or 1 thing you can taste, okay? So you can kind of lick your hand and you focus on those senses that you're feeling, all right? And the numbers can change based on what it is you're doing and where you are. So it's not always 5 things you can see, it can be 5 things you can hear, but the intention is to just utilize your senses to kind of get you through that panic attack and to ground you.
What you just said triggered a conversation I was having with somebody one day where they said to me that the environment was overstimulating, and I didn't understand what they meant, so I asked them to explain. Now, you also spoke about children, parents. So let's pause for a moment because it's important for our audience to understand. Can anxiety affect children, teenagers? Can it affect them?
Certainly.
Right.
So children and adolescents can experience anxiety. And the thing about children and adolescents is that when they experience anxiety, their symptoms or the way they present might be different from that of an adult.
Right. So help the parents here, because we'll come back to talking about all the stresses in our life. But let's deal with the children, which we all interact with on a daily basis, and the young teenagers. One, they've got the pressures of school, they've got the pressures of exams, they've got the pressures of social media, all of this. Explain to the parents who are having this generational gap, what are the things they need to look at in this particular age group that as adults, many of us are not familiar with?
Okay. So with children, children often present with some social withdrawal. So a child that might have been a bit more social or interactive, they might tend to shy away when they're experiencing anxiety. There is also usually a change for the worse in their performance at school. Adolescents, on the other hand, they usually present with more of the irritability that I discussed before. So they tend to be more violent, more explosive, lashing out. There's also a change in their performance in school because of the way how they're interacting with people.
Now, in this subset, how do we guide the children, the teenagers, the parents in what brings them to the medical health practitioner? What brings them to the psychiatrist or the psychologist? What is it they must recognize? Because I believe you would want them to come earlier than later.
Yes. So, as I mentioned before, a recurrent theme will be that impairment in functioning. So if you as a parent or somebody that's providing care for a child or an adolescent recognizes that there is something going on and you are unable to kind of pinpoint it, but you recognize some of these signs, you can certainly come down to the hospital for more professional guidance, okay?
Okay. Now let's go back to the sort of adults. So we all have pressures of relationships, financial problems, work problems. Help us, if you will, to make like a list of the top 5 stresses you see in your practice of what are the triggers for most people who are experiencing this inappropriate anxiety.
So I will tell you this. Anxiety is very person specific, okay? each individual can be anxious about their own particular thing. So it's not to say that if you do not fit into a particular category, you cannot experience anxiety. So the stresses that each individual experiences in their own particular life can be overwhelming, and they can become worried about that particular things, okay? So you asked for some of the most common things that I see. Relationships are a big one, okay? Financial security is also a very big one. Recently, I find a lot of people are concerned about where they are in life and where they want to be and how they are going to be able to achieve their goals. So fear of the personal growth. And their own future is something. You said 5, right?
No, well, it doesn't have to be 5, but the more common ones. So yeah, I mean, I think you've sort of spoken about that. Now let's talk a little bit now into treatment. As with most mental illnesses, there are treatments which are based upon conversations, and there are treatments based upon an actual chemical. We give you medications. Help us understand the two types. When may one choose one, or you choose both?
Okay, that's a great question. When it comes to mental health, there is no one-size-fits-all mode of treatment, okay? It's very person-specific, and so there are various options in terms of managing anxiety, okay? As a psychiatrist, I approach mental health conditions from a biological perspective, and so I usually focus more on medication because there is a biological premise behind the development and the expression of mental illness. Now, not everyone has to get medication. There are other ways that persons can cope with their mental health conditions. That's usually decided upon between the patient and the provider at the time of the consultation.
Okay. We're going to get into a quick true or false, but there's some important things you said before, and I want us to repeat them. I want you to repeat them. One, I want you to go back over that mnemonic you spoke about and sort of take your time and go through the mnemonic. And then that helping our audience identify that they're having this anxiety or panic attack. Walk us through a similar demonstration of what you spoke about, of how they can help themselves cope with it at that instant in time. So the mnemonic, and then what you would be telling them to do at that instant.
So the mnemonic was for anxiety. It was TRICE, TRICE. The T was for tension, muscle tension. The R was for restlessness or feeling keyed up. The I is for insomnia, which is an inability to feel like you're rested. The other I is for irritability. The C is for changes in your concentration, and the E is for energy deficiency, so feeling fatigued without doing activities.
And then so the panic attacks.
And so the panic attacks now is where there's an intense upsurge of fear that has physiologic findings. So you can have heart racing, nauseousness, feeling as though you're choking or you cannot breathe, feeling as though you're about to lose control of yourself, okay? Feeling like if you're sweating. Now, for persons that are having a panic attack, I would have mentioned the rubbing of the hands to the legs or observing their environment for different things. Another really good thing is breathing. So the way how we breathe, because when you're having a panic attack, it's an upsurge of what's called the sympathetic nervous system. And that's what causes the physiologic manifestations. And if you trigger your parasympathetic nervous system, it will cause you to relax. So practicing deep breathing is a really good way of dealing with a panic attack.
Dr. Griffith, as we're all trying to cope with anxiety, in healthcare, we're always speaking about changes we can make in our lifestyle. In hypertension, diabetes, we speak about that all the time. But as it relates to anxiety, what are some of the lifestyle changes that people can make? Or what are the things they can do that could help them with their anxiety?
Okay. A really big lifestyle change that we can all make is to practice something called mindfulness. Mindfulness talks about living in the now, because lots of times when we're anxious, we're either worried about what happened before or happened in the future. And there's really nothing that you can do about what's happening before or what will happen. And so mindfulness is a very interesting concept that talks about being in the now. Mindfulness is something that we can all practice. Taking breaks, okay? Lots of times persons are on go, 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 and they forget that it's really important to take a break and recover and give your body and your mind some breathing space, okay? Our diet has also been tremendous. So the diet that you take in addition to all of the physical benefits that it has, your diet is also linked to your mental health and well-being. Studies have shown that the kind of food you eat is really important in your mood, your levels of anxiety, and all of these things.
Okay. We're going to go on now to talking about some of the more common myths. And whilst you're going to answer this as just a true false, I'd like you to just do a little elaboration on why it may be true or why it may be false. So let's go over this. If I made the following statement, anxiety is a sign of weakness. We hear that all the time. What would you say to that?
I would say that's definitely false. Recognizing that you're suffering from something is one of the greatest strengths that you can show, because no man is an island and we all can benefit from some intervention in our lives somewhere or another. And that strength that comes with feeling empowered to recognize that something is wrong with you is tremendous.
Now, there is this bias that some conditions don't affect certain genders. So you will hear, we men, we don't get anxiety. Is that true or false?
False. So while anxiety might more commonly affect women, men are also extremely affected by anxiety. In fact, men are often more susceptible to dying by suicide.
Our children don't get anxiety.
False. The Diagnostic and Statistical Manual of Mental Illness have specifically identified disorders that only affect children, like separation anxiety disorder and selective mutism. So children can be affected by anxiety too.
We live in a deeply religious country, and many of us will say, or you will hear this often, that if one were to just follow the spiritual pursuit, it will cure the anxiety.
False. While religion is really important in our lives and it serves as a tool that helps our own mental health, prayer and religion alone will not cure anxiety.
And finally, anxiety is treatable.
Yes, anxiety is certainly treatable. We do it every day.
That brings us to the end of this episode of Ignite Health in partnership with Caribbean Surgery Inc. Today, we learned that anxiety is common, treatable, and most importantly, nothing to be ashamed of. Recognizing the signs early and seeking Recognizing the signs early and seeking support when needed can make a significant difference to a person's quality of life. I'd like to thank our guest, Dr. Triston Griffith, for sharing his expertise and helping us better understand anxiety and its impact on individuals and families throughout Guyana and the Greater Caribbean. If there's one thing to remember, it's this: mental health is just as important as physical health. If anxiety is affecting your sleep, your work, relationships, or overall well-being, don't suffer in silence. Please don't. Speak with a qualified healthcare professional and seek the support you deserve. I'm Dr. Surendra Persaud, Medical Director at Caribbean Surgery Inc. Thank you for watching this episode, and we look forward to seeing you in the future.